Assalamu alaikum. My name is Dr. Riffat Naheed. I am a clinical psychotherapist, a hypnotherapist, and a trainer. I initially graduated from AMC. I worked in Army for almost 19 to 20 years. Then I took premature retirement and I joined United Nations. My experience is basically up to 40 years in this field, and I have just come back to Pakistan a couple of months ago, and I have opened my own clinic in Bahria, Phase 7, Islamabad, and it is called Healing Haven. You can find my lots of videos regarding how to remove the stigma of the mental health that is related to people के कोई भी तकलीफ़ हो तो उसके लिए डॉक्टरों के पास तो वो दौड़े दौड़े जाते हैं, लेकिन अगर मेंटल हेल्थ की प्रॉब्लम होती है तो उनको ये लगता है कि नहीं, लोग हमें पागल समझेंगे या लोग ये समझेंगे कि मेंटल हेल्थ का प्रॉब्लम है। लेकिन आपकी बॉडी जो है वो आपके माइंड को फॉलो करती है, और अगर आपका माइंड हेल्दी है तो आपकी बॉडी हेल्दी होगी। मेरी जो पीएचडी थी वो मलेशिया और कायद-ए-आज़म यूनिवर्सिटी से, आईआईयू इस्लामिक इंटरनेशनल यूनिवर्सिटी से थी, एंड माय स्पेशलिटी वाज न्यूरोसाइकोपैथोलॉजी और मोस्टली रिलेटेड टू स्ट्रोक पेशेंट्स एंड हाउ द फैमिली कैन हेल्प देम. During my service of very long time in almost 47 war zone countries in United Nations, I have done my graduation from Harvard Medical College in global mental health. Apart from them, I have done almost 30 to 35 plus courses related to stress management, anger management, being unbiased, being culture sensitivity. I also look after those people who are having addiction problems. I do focus groups on them as well, and I love to work with people who have family issues, those who are having teenager problems, those who are suffering from depression or PTSD, OCD. I also do testing for IQ and EQ, and one of my most favorite therapy is regarding making proper food plans for obesity. इसलिए कि obesity जो है that leads to a lot of problems that are related to depression, lack of confidence, self-worth, relation issues with between the families, and you can develop joint pains, you can have sugar, you can have heart problems, you can have a stroke, you can have high cholesterol, you can have high triglyceride, etc. So I make people work on their diet plans and a bit of light walking, and many of them have lost by they have lost their weight into kgs, and they have high spirits, they are happy people now. I also do speech therapy where it is needed. I am also I'm a hypnotherapist. People usually ask, what is hypnotherapy? Hypnotherapy is basically one form of therapy in which I just make the client lie down, and those events that they have forgotten or they are in their unconsciousness gaining energy and they are unable to talk about it. So during the hypnotherapy of different types, it can be erasing the old memory, it can be making new memories, it can be one form of making them understand how to change their behavior. I look after PTSD. Again, PTSD means a post-traumatic syndrome disorder. OCD, obsessive compulsive disorder. ये वो terminologies हैं जिसमें आप obsessively, compulsively एक disorder में चले जाते हैं and you don't want to take any medication for that. So I go into the deep root cause of why they developed the OCD and how to treat them without medication. And the same is with the PTSD. कोई trauma हुआ, कोई head injury हुई, कोई ऐसा वाक़या हुआ, बचपन में bullying हुई, या husband wife के relations में कोई इस तरह का problem हुआ, या बच्चों के साथ कोई problem हुआ, तो वो आपको, या जिस तरह के हालात हैं, जिस तरह मैं जॉर्डन में जिस वक्त थी उस वक्त पैलेस्टीनियन बच्चों के साथ काम करी थी, दे वर मोस्टली सफरिंग फ्रॉम PTSD एंड जहाँ पर एक तरह से वॉर जोन कंट्रीज़ में काम करी थी, यहाँ आई हूँ तो यहाँ पे भी अभी एक तरह से वॉर ही चल रही है. तो a lot of people are really suffering from a lot of problems and they are going around looking for the medical doctors, which is fine. They are going to the neurologist, which is perfectly fine. But they're not looking at what is the reason of this problem. I believe in one thing, that symptoms do not read books. So I look at the symptoms and then I go in depth looking for the reasons through EQ. EQ means emotional quotient, जो बहुत कम लोग, लेकिन that is also called projective techniques. उसमें ये होते हैं कि कुछ अल्फाज दिए जाते हैं, कुछ वर्ड्स दिए जाते हैं, कुछ इनकम्प्लीट सेंटेंसेस होती हैं, कुछ इनकम्प्लीट स्टोरीज होती हैं. और आर्मी में रहते हुए भी तकरीबन डिफरेंट ISSBs में और GHQ में मैंने इसके ऊपर काम किया हुआ है. आई वॉज ऑल्सो OC CAC, ऑफिसर इन चार्ज कैडेट एडवाइजरी सेल इन PMA फॉर 2-3 years. एंड उस वक्त कारगिल की वॉर हो रही थी, तो आई वॉज सेलेक्टेड एज बेस्ट आर्मी ऑफिसर एज वेल एट दैट टाइम. I ensure this thing that emotionally, if you are healthy and mentally you are healthy, then your body will follow it. So my usual pet sentence is that the past, whatever happened in the past, needs to be forgotten because you cannot change the past. And the future is in the Almighty hand. Whether you are a Muslim or a non-Muslim, or you are whichever religion you follow, in UN, all religions, we work with all kind of religions and all kind of cultures. So I've learned one thing, that at the end of the day, सब मानते उस एक अलमाइटी ताकत कोई है और फ्यूचर उसके हाथ में. हो सकता है कि जिस वक्त इसकी एडिटिंग होके मेरे पास आए तो इनको ये पता चले कि डॉक्टर रिफत नाहीद को तो हार्ट अटैक हो चुका है, विच इज़ पॉसिबल. या खुदा ना खास्ता आप लोग इधर से जाते हुए आप लोगों का एक्सीडेंट हो जाए, कोई बीमार हो जाए. सो वाई वरी अबाउट फ्यूचर, दैट इज़ नॉट इन आवर हैंड्स. सो वी शुड स्टे इन दिस मोमेंट. इस मोमेंट को हमें एंजॉय करना चाहिए. एंड देयर आर मैनी वेज of how to improve your emotions, how to stay happy, and how to live in the moment. The past is history, you cannot change it. And the future is in Almighty's, Allah's hands, so why worry about it? Apart from them, there are many other topics that I have made many videos on that, like different kind of therapies, like CBT, like the 4 P's of psychotherapy, and I also welcome myself to Pakistan. I stayed back in Pakistan only because I realized that in Pakistan we have lots of problems and people don't even know that they have these mental issues, emotional issues, OCD issues, PTSD issues, family issues, and the children have ADHD, or maybe they have some bullying issues, or maybe they have so many issues that are not addressed properly. So, always go to the right professional. If you are not ashamed of going for a headache or a stomachache to a doctor, why are you ashamed to coming to a mental health professional? Thank you very much.